My name is Dr. Alok Sharma. I'm a consultant neonatologist working in Southampton University Hospitals, which is based in Southampton in the UK. So the neonatal unit that I work in based in Southampton is called the Princess Anne Hospital. It is approximately 40 bedded with 24 intensive care beds. We look after the smallest, sickest babies in the United Kingdom, specifically catering towards the southeast. That includes babies who need surgery, babies who need or have problems with their airways, and babies who need cardiology input as well as the smallest babies, babies between 22 and up to 31 weeks gestation. The Indian neonatal scenario is catching up in a big way. We've seen huge developments over the past few years in that they are working towards helping and resuscitating babies who are smaller, who are sicker. We're looking towards moving towards the use of new therapies like therapeutic hypothermia, the use of nitric oxide, and this is happening in private hospitals, but we see a lot of hospitals even in the public sector being able to fund and develop effective, good neonatal units, which are doing a fantastic job considering we have the second highest population in the world after China. The grassroots levels are also coming up. We now have these new neonatal units which cater to babies at the peripheries, and we have a huge workforce which needs training at this particular point of time, which the National Neonatology Forum is doing a huge amount of work to get up to speed. We have a collaboration with the National Neonatology Forum, which was set up by Dr. Amit Gupta in Oxford and started in 2011. And this collaboration basically involves us training postgraduate doctors from India who have a special interest in newborn intensive care. Our purpose is to try and provide top-up training to them, in particular provide training in fields of neonatology so that they can actually bring their experience back to India and help disseminate that experience through education and wider practice. So far, Oxford and Southampton are part of this partnership. We're two hospitals working together, and both hospitals have actually trained 39 doctors. We've obviously been greatly helped by the National Neonatology Forum and Dr. Ajay Gambhir, who worked with Dr. Gupta to try and bring this collaboration together. And it's ongoing. We're here to interview this year as well, and we have approximately 10 posts that we're looking to fill. But from our perspective, what we're trying to do is provide trainees, postgraduate trainees from here, structured training in the UK to a standard that we provide to trainees in the UK at par with trainees in the UK, so that they can bring that additional experience back home to India in order to support neonatal services and newborn healthcare right at the grassroots levels, right up to the top. These programs are 2 years at a stretch. We have spoken to the Royal College of Pediatrics and organized a collaborative initiative through the Medical Training Initiative Scheme. The college helps to provide sponsorship for eligible candidates who we interview over here. Selection is purely by merit. We obviously want the best candidates who we feel will be able to benefit from training in the UK, and we want those candidates to be able to train. We have an initial period where they spend familiarization, so spend time familiarizing themselves on the neonatal units in Southampton and Oxford, which is about 6 months, followed by a further 18 months to complete 2 years of top-up training, where they can have a focus on newborn care with newer modalities of treatment like therapeutic hypothermia, ventilation of extremely small babies, in particular babies between 22 and 28 weeks of gestation, new forms of ventilation like high-frequency oscillation, use of nitric oxide, things that are available and coming up in India, but where we still have quite a gap in experience for people being able to use these modalities. We also give them the ability to develop a specialty interest, whether that be neonatal cardiology, neonatal transport, again, things that are coming up in India in a big way. And our hope is that by providing them the structured training, we'd be able to give them something so that they can then take back to India and help disseminate. And, in a way, they also bring a wealth of experience to support our systems, and that they are very skilled and very well trained. I think from our perspective, we must recognize that newborn care in India is expanding in a big way. We have a huge population. We have a birth virtually every 3 seconds at this particular point of time. And, we have to look at how we can provide and sustain services as well as education to bring out the best outcomes for those babies. Now, that is something that obviously takes time. Our healthcare system is robust, but the additional help that we can provide through this collaborative initiative will help them bring additional skills back to India, is our hope. Skills that they can then impart to people at the grassroots levels and help move from bottom to the top, bringing the best outcomes for babies in the healthcare system over here. And it's something that's provided in other countries like Australia and Canada as well. So in the UK, we do not want to lag behind. We want to be part of this initiative. We want to be part of the newborn care's growth in India. So the training program started in 2011. Sponsorship is through the college. There is no fee that we charge for the training fellowships from the candidates. They actually get paid a salary to work in the UK, a salary which is at par with UK postgraduates. And from our perspective, the intention is they work as part of that in the UK health system, getting experience in neonatology. So we don't have a fee that we charge for it. One of the biggest problems that we face with healthcare for newborns in India is there's a huge disparity in healthcare services as provided at the top echelons of society versus what is available in the peripheries. And that's a gap that's very difficult to bridge. I think we need to acknowledge that with a population like ours and with the geography that this country has, there are limitations that we have to fight against. But we have to do this together. And I think, by collaboratively working with the National Neonatology Forum, there's a system of accreditation where they're working towards accrediting units by actually certifying that there's appropriate staff at each level to care for the babies. Hopefully, that disparity will gradually even out. We have 39 people to interview today, and they're from Bombay, from Kerala, from West Bengal. We've got a candidate from Jammu. So a wide variety of candidates, and in particular candidates who've been selected on the merit of how they perform. We go through a very rigorous shortlisting process where we ask the candidates to apply 6 months in advance. We look through their applications. We make sure that we are taking candidates who are the best and who we believe will benefit from the training abroad so that they can actually bring such training back to India to take things forward.